Hello, my name is Abigail Flores, and I will be discussing gas gangrene. What is gas gangrene? In order to approach this question, we will first have to know what gangrene is. Gangrene is the death of body tissue due to the lack of blood flow, which is often caused by a serious bacterial infection. There's different types of gangrenes. There's dry, wet, gas internal, and there's a few other ones, but for this discussion, we will only be focusing on gas gangrene. Gas gangrene is also known as clostridial myonecrosis, and its most common infectious agent is called Clostridium perfringens. Its nickname is the cafeteria germ. I will explain this nickname later. So, where does gas gangrene happen? It normally happens in the trauma of a wound or a surgical wound, but the most common form is through trauma of the wound. So, what are some characteristics of Clostridium perfringens? So, in its vegetative cell form, its shape is a rod, and it's normally found in pairs and long chains. So if you could see this stain, this endospore stain right here, you can see the chains right here, like the V shape right here. It's just two of the bacteria together. So that's what they mean by chains and growing in pairs. So they're gram-positive cells. So right here on your right, this is a gram-positive stain, and you could see the crystal violet still present in the membrane, so that's how you know it's positive. It's non-motile, but they do have some sort of motility. It's called gliding motility, and from what I know of gliding motility, it doesn't require flagella or other things in order to move. So they're obligate anaerobes, which means that they don't like oxygen, they can't secrete their toxins, and they're also spore-forming bacteria. They also do fermentation. Now, I starred these two characteristics because they will be very important in our later discussion of these bacteria. So I do have to warn you, in future images, they will be a bit graphic. So symptoms. So the symptoms here are changes in the skin. So the skin typically turns from pale to gray, dark red, purple, and black. So you could see this in the image down here. There's a variety of different colors. The skin not only changes color, but as it also grows blisters, and they secrete a foul-smelling discharge. The other symptoms vary, such as fever, low blood pressure, excessive sweating, the heart rate increases, vomiting, wound doesn't heal, and septic shock, which means that the organs stop working due to the insufficient low blood supply. I put the symbol because I'm going to be coming back to this slide in order to further explain this. I feel like we need a bit more background information first. So pathogenesis. I simplified how the bacteria comes into our body, and I'll explain it to you. So first, it enters into an immunocompromised individual's wound, and they're typically in the form of a spore because they're obligate anaerobes. So the only way they would survive up in oxygen is if they're in the form of a spore. So you could say it's this one right here. But another really important factor is that other bacteria, if this bacteria is able to go into the wound, that means that other bacteria are able to go in this wound. Other bacteria like obligate aerobic bacteria. Now, the reason why I mentioned these other possible bacteria is because when your body forms a scab or tries to heal itself close, then it also encloses all the variety of different types of bacteria inside the wound. So the Clostridium perfringens is also in here along with other bacteria. Now, this other bacteria utilize all the oxygen inside that wound until there's no more oxygen in that wound. And that means that those bacteria are no longer able to be in that environment, but that's when the Clostridium perfringens thrives. Here's an animation of what they kind of look like. So after the bacteria consume the oxygen and the Clostridium perfringens come from spores to vegetative cells, then these vegetative cells start secreting toxins. And for those of you who skipped the symptoms side due to the graphic image, here's another simplified version of what they can do. So some of you may be asking, what are these toxins? There's a variety of different toxins in Clostridium perfringens, but the two main ones that cause these symptoms or the death of the tissue is the alpha toxin and the theta toxin. So the alpha toxin performs hemolytic activity, which means that they just destroy the blood cells. They form the production of phospholipase C, and what happens is that phospholipase C starts targeting the membrane cells and they perform lysis, which is destruction of the membrane, and the cells just starts oozing out. This isn't limited to red blood cells. This also happens to your white blood cells, your platelets, which your platelets are what go to the wounds to try to heal it, macrophages, nucleophiles, natural killer cells, all of these cells that are trying to help you against the foreign pathogen. So you also have theta toxins, and their main role is to damage the blood vessels. This is very important to note because the blood vessels are the only passage that the blood can flow through. And blood is actually one of the main sources of oxygen around your body. So they really, really want to destroy those passages and destroy the blood because they don't like oxygen. This image right here is a simplified version of the alpha toxin and the theta toxin. And I also included this image right here because these are two neutrophils, and this is your perfringens. I wanted to compare the size between your actual immune system cells and the bacteria, because I was like, wow, the size is very different, but they have such a large effect on your immune system, which is crazy. Okay, so this is a muscle biopsy, and I wanted to explain what we basically just talked about into this muscle biopsy. So right here, this patient actually had Clostridium perfringens. You can see in this image right here, these little dots actually represent neutrophils. So the body's going under the inflammatory response, so it's sending the immune system cells to that area to try to contain the foreign substances that are happening here. Now, if you've noticed, there are not many dots or not a lot of neutrophils that should be in this site, and this is due to the alpha toxins that are being secreted by the perfringens. And since there's not a lot of neutrophils present, then not a lot of impact is being made by your immune system. On this red arrow, you can see that there's space between these two cells, and this space represents the gas that's being produced by fermentation of the perfringens. On top of that, the inflammatory response is also trying to make space for the neutrophils and the inflammatory cells to go through, but this is also because of the gas production of fermentation. Now, I would like to return back to the symptoms so we could further discuss what we just learned. So the black tissue the tissue is turning color because of these toxins being secreted, and that's why the cells are dying, so they're going to change color. You're experiencing fever because your body is going in inflammatory immune response. The low blood pressure is due to the alpha toxins that are being secreted because they're destroying your blood cells. The excessive sweating is due to your high fever, so your body's trying to cool you down. The increased heart rate also goes with the fever. Fever and increased heart rate are they're factors that they start increasing. So the wound is not healing because in order for the wound to heal, it has to have oxygen, or the rate of healing increases if you have oxygen. But this infectious agent really doesn't like oxygen, so the wound is not going to heal at the rate it should heal. And septic shock is due to the low blood pressure, so your organs are going to start malfunctioning if it gets that severe. So, where does Clostridium perfringens come from? No need to alarm, but does come from the soil, or it is very common in the soil, but they don't like to stand on the surface of the soil because of the oxygen. So they're typically found deeper within the soil. They're also in most foods that are not contaminated, so they're improperly cooked or stored. And the reason why I wanted to include this was because the hospital itself has cafeterias and they serve these foods to their patients, so they really have to work really hard to make sure not to have any crossovers. And surgical site infections are also a common way to get this gaseous gangrene. So, treatment options: draining of the wound, dead tissues removed, and implication of antibodies. These steps are the general steps that your health professional will recommend. So, the antibodies that are commonly used is penicillin and clindamycin. So, clindamycin is used to reduce toxin formation, which is the alpha and theta toxins that perfringens is producing. And they also include penicillin because when some of the Clostridium is resistant to clindamycin but are susceptible to penicillin. Now, other forms of treatment vary depending on the patient's from patient to patient. So operation to improve blood supply, only when the patients do need it. Treatment of intensive care units, typically it doesn't get that severe if it's treated more quickly or the sooner it's treated. And hyperbaric oxygen therapy is also another form of treatment, though it is rare, and in some articles it is even controversial. So I hope that you learned something from this presentation. Hopefully you have a nice day.